Hello. All right. So are we ready to go?
Yeah, you can go ahead, Jim.
All right. So this is actually, I put this talk together and I was so happy with it. And I thought it was pretty impactful. And I think we'll end up sharing this with everybody in the Metabolic Code portal anyway. But it's really about understanding food allergies and intolerances and what's going on today. And, one of our lab partners is Infinite Allergy Labs. Like, I think they've got very novel testing, and they've got testing that actually gets covered. So I think it's pretty robust. And I think what's interesting is that they measure something called the complement. So you get the C3 complement and why that's important. So let's just go through it and see if we can learn something over the course of the next hour. So obviously, I've got to get the groundwork down. We know what an allergy is. It's a hypersensitivity reaction mediated by immunologic mechanisms. It could be antibody mediated or cell mediated. Typical antibody responses in allergies is IgE. There are both environmental and food allergies. Obviously, over the last, I don't know, close to 40 years, I've seen a tremendous uptick in environmental burden as well as people that are intolerant to foods. And then, of course, realizing there's a difference between allergy and intolerance, which is a non-immune related reaction. When you look at the statistics, this came right off of the cdc.gov site in February 2020. 15 million people in the US suffer from food allergies. That's 4% of adults. That's the strict food allergy. About 8% of children suffer from food allergies. And then in 2013, there was an increase of 50% in food allergies from 1997 to 2011. And then globally, 20% of the population alter their daily diet due to a perceived adverse food reaction. That perceived adverse food reaction a lot of times lies in that sensitivity realm and not necessarily in the strict allergy realm. So, where does it begin? So obviously, if you look, yeah, you see the little epithelial cells and you have an allergen, and the allergen passes through the epithelial cells of the intestine and hits the antigen presenting cell, which triggers Th2 cells, which Th2 cells are what's responsible for creating the antibody response and pro-inflammatory cytokines. So you see the development of the IgE antibody to that antigen. It then is placed on the cell, which then can trigger the mast cells, which then can trigger histamine, leukotrienes, and inflammatory cytokines. And of course, the other response is you can increase the eosinophils, and that's what creates clinical symptoms. And then, the more the gut gets eroded, the more that the gut is broken down and has a lack of permeability. And if you've listened to any of our triad talks, you know that stress can cause a leaky gut and lead to an enhanced food response. Pesticides like glyphosate or atrazine can do that. Deficiencies in nutrients like glutamine could do it. And then really a whole host of drug therapies can alter gut permeability. So understanding it that what the reason for this increase in why people were having food allergy responses and sensitivity responses is the fact that their metabolic inflammation has been enhanced over the last 20 or 30 years at the very least due to environmental burden, stress, poor food quality, excessive use of drugs, etc. So IgE, of course, antibody response leads to allergic reactions can occur, it can occur immediately, right? Where I can have that in that reaction, or it can be up to 1 to 3 hours later and you get, atopic dermatitis, allergies, eczema, asthma, sneezing, all those kind of things that are listed here, wheezing, shortness of breath. Or there's the IgG4 complement, which is the complement to the IgE antibody response and blocks IgE. So high levels of IgG4 leads to an inflammatory response. And there's actually evidence that shows that it contributes to eosinophilic esophagitis, thyroid, ovarian, and prostate tissue. So if all you're doing is measuring IgE or IgG and you're not measuring IgG4, you're missing the immunologic response. Their IgE may be normal, but they're making a tremendous amount of IgG4 to counteract the effect of the IgE. So it's really important to understand these facets of the, these antibody responses. So if you look at it from this perspective, on the sensitivity side, 45% of the population is thought to suffer from some kind of food sensitivity. And symptoms typically aren't life-threatening, but it's, it's bloating and joint pain and irritable bowel and tiredness and eczema and, it's, mood and dry hair and constipation, weight gain, hives, rashes, abdominal pain. And then, of course, it could be self-assessed by eliminating foods and then putting them back in to see how you feel. But the big challenge with this is that the reaction's usually over 72 hours. And of course, if you look at the common causes, wheat or gluten, milk or dairy, corn, eggs, sesame, soy, there's environmental triggers that can do it. But then there's the food allergy, which is basically developed from infancy, and it's 2% of adults and 6 to 8% of children. I think that 2% of adults actually went up. And then it can be severe and life-threatening, obviously, difficulty swallowing, nausea, hives, itching, wheezing. And it's an immediate reaction, and it's usually within 2 hours of eating, or it can be immediate. Obviously, peanuts and tree nuts are in there with that, along with things that were in the sensitivity side, eggs, milk. Fish can do it. Some people can have, people can even develop a food sensitivity to fish, but typically they'll have an IgG, IgE. And then there's stinging insects. Medications can trigger an anaphylactic reaction. All right. So that's where we get into trouble, because an allergist is usually saying, well, these food intolerances are not allergies. It's true, they're just a different category of it. So when you look at IgG, this is food sensitivities that have a delayed reaction of, from 3 to 72 hours. And they're typically less severe than IgE. You can typically work to erase them. But one of the big things about IgG is that it can trigger chronic low-grade inflammation, or what we call metainflammation. And it also drives, it can drive a histaminergic response, just not as dramatic of a histaminergic response. Now, the fourth category, which is really, I think, incredibly important, is the C3, B, and D complements. And these are the complement to IgG sensitivity. So once again, if you have any C3, any immune complement present, then the response in the body is amplified as high as 10,000-fold if there's any IgG present. And that can cause significant increase in symptoms. So if you have IgG and you have C3BD of a particular reaction, that's going to give you trouble to a magnitude of up to a 10,000-fold response. So what's the importance of IgG in food allergies? Well, it's about 4% of antibodies. It's called the blocking antibody. Just think of it that way. It's blocking IgE. But the higher the IgG, eventually that means it's going to move to IgE. And you guys have seen this. You've had people say, I could eat strawberries my whole life, and now all of a sudden I came up with an allergy to it and my airway closed. It wasn't all of a sudden. They were building up the IgG4 class of immunologic response probably for years, and finally the threshold it took over, and now IgE got kicked in. So IgG4 inhibits activation of mast cells and basophils. It obviously inhibits the more serious IgE mediated reaction. and then captures allergens prior to the arrival at the cell-bound IgE. So it's basically, before it hits that IgE antibody, the IgG4 is, absconding with it. It's taking it. And then it competes with IgE for the same binding epitopes. So IgG4 is the way for us to tolerate our food reaction. The problem is that as you build and build and build, and you end up shifting your IgE response, it's going to be pretty dramatic by the time you get to that point. So if you look at this, it's an indicator of allergen exposure. It decreases false positives because you can see, another category of what's being exposed. And then measuring IgG4 lets you either rule out or confirm intolerance as the cause of the symptoms. So you could have no IgE, have IgG4, and it's every bit as important to minimize IgG4 exposure as it is to minimize IgE exposure. And so you want to remember that on the next piece is IgG. And IgG is that generalized low-grade inflammatory response. Oh, I eat gluten, my joints ache. Oh, I eat gluten, my head gets foggy. And the C3bd dramatically amplifies the IgG response. So it creates a pro-allergic effector function. And then it regulates Th2. So if you look at this at the bottom, it says complement component C3 plays a versatile role in the process by keeping a cascade alert on, acting at a point of convergence of activation pathways and fueling activation of the complement response. So once you have a C3bd response, and I'll show you one on a test, once you have that, person's really got to work hard to avoid that food. Because you have to do a counter correction on their gut, healing that mucosal barrier, working on their immune system, maybe doing slit therapy on them, sublingual immunotherapy on them in order to correct it. So if you look here, the development of C3b and D signaling, if you look at the top, you've got danger sensing. So this is the danger sensing damp particles, right? And you get immune sensors. So we have, immune sensors that are triggering C3, C4, C2. And if you look here, when it hits the C3 surface, it triggers these different C3 reactions in the immune complement pathway. And so basically, the more I can keep upstream with this, the less likely I am to develop this immune complement. So when you think about it, so now that's our tenet. IgE matters, IgG4 matters, IgG matters, and C3bd matters. And actually, I would argue that the C3bd and the IgG4 may be more important than the actual IgG or IgE. So, if you're looking at a tennis court, that's basically the surface area of your intestine, which I think is amazing. So this is the pretty straightforward, thought process, right? A healthy gut on the left. You have intestinal mucosal cells. You've got pathogens. There's nutrients. There's undigested food particles. There are tight junctions. And the reality is, with a healthy gut, you absorb particles into the bloodstream down here at the bottom, right? And you also have some immune cells floating around down at the bottom. But then under antibiotics, autoimmunity, environmental pollutants, low stomach acid, NSAID, stress, any number of things create a leaky gut. So if you look here on the right-hand side, you've got a leaky gut where the tight junctions are broken down, immune cells are pouring through, you're getting bacterial passage, you're getting less nutrient absorption. And that's what we're trying to heal right there. And this is a great, I love this picture. If you look at the right on A, this is a healthy epithelial cell barrier. If you look over here in B or C, this is a similar picture where it's cracked. And this is because the lining of the epithelial cells has become leaky. So you see, nice and tight. This is leaky. Over here, look at the epithelial cells. They're all nice and tight. Look over here. They're leaky. So this is literally what's happening. This particular study was the microbiota dysbiosis and barrier dysfunction in inflammatory bowel disease and colorectal cancers, and exploring the common ground hypothesis. I'm going to close this door quickly. There we go. And so that's our job right there. We've got to make B and D go back to A and C. And the more stress we're under, the more medications that we're on that disrupt the microbiome and cause changes in pH, the more that we're exposed to environmental burden, the more we have a poor diet, the more we create that B and D scenario. And so, of course, when you think of triads, you think of the gut immune brain axis. And, you know, hopefully you've learned this, that it's primary command and control, right? The brain to the gut, the enteric nervous system. The gut can signal the brain can signal the gut. And it's the major filtering and defense and repair mechanism for your body, right? When I have to, my immune system, 70% of it, which is in the gut, I have to create balance in my immunologic response. And when my gut's broken down, I'm going to tend towards pro-inflammatory chemistry. When it's normal, it's organized and secured. When it's not, it's disordered. And I'll just ask you, think of people with irritable bowel. People with irritable bowel have to run to a bathroom. They go to any store, any restaurant, and they're scoping out where the bathroom is to begin with. And of course, there's that high correlation of anxiety to irritable bowel. But the goal would be, think about when you're, I hate to be graphic, but think about when an individual, they come back to you and they're doing great. Their bowels are normal. There's just, for them, there's nothing like feeling secure with normal elimination and no discomfort. So it's really important to see how you're going to, help clean this up. I believe that if you don't do food allergy testing, I do it on a lot of people, that you miss one of the big levers that are dictating that inflammatory signaling. So if you think about it this way, you've got the brain up top, which is cognition and memory, mood and emotions, and the central controller of physiology. You've got the gut, which is that single epithelial layer. It's initial metabolism and transformation of biochemicals, and it's also a structural defense from the outside world to the inside world. And then there's the immune system, which is both innate and acquired, and is involved in the repair cycle and cell-to-cell communication. Now, here's the thing about repair cycle, right? Remember, we talk about with metabolic inflammation or metaflammation, that when a person can't requite their inflammatory response due to an injury, that they stay inflamed, right? That's the issue around, metabolic inflammation, that their immune system stays stuck in an inflammatory process. So when you think about this, then, the key things are, I can get intraepithelial cell upregulation, upregulated antigen presenting cells. All of a sudden I've got dysbiosis, my intestinal permeability is off, and people literally start to feel really poorly when this starts to happen. So, the mucosal lining of the intestine, obviously made up of glycoproteins. And honestly, what you do is you got to get that microbiome fed plenty of rich fiber, so resistant fiber that can fuel it to be able to make butyric acid and make these epithelial cells nice and puffy. So, when you look at this, this particular slide is just to remind you that there's all kinds of players in the immune system in the gut. So you've got intraepithelial lymphocytes or gut-associated lymphoid tissue. You've got Peyer's patches, isolated lymphoid follicles, as well as memory cells or M cells. And you got to remember, epithelial linings, one cell layer deep. Only, it's the only barrier between the intestine and the lumen of the bloodstream. So it's important to keep these under control, and they're joined by tight junctions. They're controlled by occludin and zonulin, and normal levels of lymphocytes and epithelial cells maintain tight junctions. Excessive lymphocytes damage tight junctions. So if you have people sitting in front of you that have a tremendous amount of, gas and bloating, and I'm allergic to these 24 foods, and I know I am, their tight junctions are eroding. And then, of course, there's the gut-associated lymphoid tissue, and that's inducing secretory IgA. So people that have worn down secretory IgA, in general, what will happen is that, they've been reacting for a long time. When my sec IgA is low, my immune system's compromised. I kind of already went over this. I'm going to go to the next one. So then you have this whole thing of major histocompatibility complex. So and this is important because it relates to the HLA class that are located in major histocompatibility complex. So basically, if you've been studying, Richie Shoemaker's work and Andy's work on biotoxins, you know that we look for those HLA classes of gene SNPs because people are more prone to trigger inflammation. So, and therefore more autoimmunity. So one of the reasons it's so important to do the gut correctly is it's helping to stem back that tide that turns people towards becoming an autoimmune disorder case. And then, of course, there's the dendritic cells. And I think it's just important to note that dendritic cells activate toll receptors, and that toll receptors can be they're all trying to do good things for us. It's just that when we downregulate our toll receptors that are driving our food allergy responses, when we're not able to dampen them, now all of a sudden those food responses really can start to take hold. When you think of this, aging, inflammation, and gut permeability, this is age-associated modifications in intestinal permeability and innate immunity in the human small intestine. This is a 2015 study. IL-6 starts going up with age, and look, IL-6 goes up in people that overtrain. IL-6 goes up in people that have biotoxin illness. IL-6 goes up in people that have environmental pollutants. So IL-6, it becomes unregulated with age, and that leads to permeability in the gut changes. And that's this is a further extension of that information. IL-6 regulates claudin-2 expression in the tight junction permeability of an intestinal epithelium. What does that mean? When your IL-6 goes up, it activates claudin-2. When claudin-2 goes up, the tight junctions break. So it markedly induces the expression of claudin-2, and in which case tight junctions definitely get disrupted in the protein folding scaffold. That just fails. And this is just a picture of that, guys. This is the space between two cells are these tight junctions. And now I've got IL-6 that's getting activated that leads to triggering claudin-2, and claudin-2 triggers the tight junctions to be disrupted. So patients that suffer from allergies may suffer from chronic health conditions. So I can tell you right now that almost all of these, I've seen at some time or another where they did their allergy test and they were dramatically better. So I would, keep in mind, it's not just GI symptoms that matter. It's also, it could be prostate. It could be chronic fatigue. It could be anxiety. It could be insomnia. There, I got to bring them up for a second. So 2018 study showed 100 patients with diagnosed autoimmune disorders had high levels of autoimmune nuclear antibodies versus controls. Food intolerance profiles in autoimmune patients were clear. So overall, much greater reactivity to food epitopes in the autoimmune patient versus controls. And then IgG levels significantly increased in autoimmune patients. You've got to measure the C3bD on your autoimmune cases because their IgG may not be picking up which foods are the most severe reaction, where the C3bD does pick up the most severe food reaction. And then, of course, with irritable bowel, you've got 80% of IBS reported to be triggered by food, gluten, wheat, related proteins, usually the ones, but they also malabsorb nutrients. And then mood disorders and depression, schizophrenia, heightened anti-gliadin immune response and to gluten, and increased celiac. And then in depression, also linked to food antigen, IgG-mediated hypersensitivity. I've seen this happen with folks plenty of time. Take them off of their offending foods and their mood gets better. But it makes sense, right? Because you're triggering an immunologic drive. It's signaling upstream up into the enteric nervous system and causing problems with the brain. Other things that are associated with it: chronic pain, fibromyalgia, obesity. Childhood obesity is associated with allergic disease, and adult obesity is associated with food intolerances. Here's what it looks like. So if you take a look, you can see, for example, that aspergillus mix. That person shouldn't try to get exposed to aspergillus too much. If you look at the barley, so if you look at barley here, 2.5 is the threshold, and if this is a 15, that's a big deal. But if it's 2.5 is the threshold and this comes back, 2.51, probably more something they rotate. But as soon as you see these in the C3, these are the ones that relate to autoimmunity, and these are the ones you would be concerned with. On the IgG4 side, likewise, you're using this to try to take the pressure off of that. And here, of course, there's environmentals that come with that test as well. And this is what you can think of. When you get this food allergy test, you could either take the big list or just the most significant list. This is a mild restriction, meaning these are the only things that you should think about restricting. And the only time I do that is when people are really kind of non-compliant and scared to start. But I'm in general trying to convince them, just go ahead and do it. Not everybody's going to have a million reactors. And this would be the more extended list. And I always recommend people do the more extended list if they've got autoimmune disorders or they're battling some other big condition, because it's going to help take up more of that inflammatory signaling. Whoop. So what are the other factors involved in immune dysregulation? Well, medication's big. 25% of all drugs on the market disrupt the microbiome. So stress is big, diet is big, alcohol use, exercise. Do I overtrain? And environmental burden, of course. And of course, the effects, they reach everywhere from autoimmunity to heart disease to obesity to metabolic syndrome and diabetes. And then if you look here, what are the factors that influence the flora? So you got to do this inventory, guys. This is how you're going to fix someone's gut. What's their stress like? What are their allergies like? What's their sugar intake like? What's their radiation and chemotherapy like, if they had radiation or chemotherapy? Just to name a few. And then here are the drugs that affect the microbiome most commonly. These are drugs people are on every day. And we're wondering why we're seeing this spike in all this intestinal issues, because people are on these drugs every day. They're affecting their immunity. And then, of course, there's antibiotics in yeast. People stay on antibiotics. They start to grow yeast. The yeast makes mycotoxins. The mycotoxins damage, your kidneys and bladder, in addition to other organs like the thyroid, really sensitive to this. And when you're rich in this kind of production, you make more acetaldehyde. And I think it's important to understand the role of acetaldehyde. So acetaldehyde is basically an aldehyde, but it's toxic to cells and tissues. The more you make, the more you melt your body. You're damaging your tissue. It needs to be broken down. It gets broken down in the liver and the lymph. When the liver and the lymph get overwhelmed, you have circulating lipopolysaccharide, or the circulating aldehyde. And the side effects are depletions of B1 and B3. That means I'm going to get more insulin resistant. I lose the ability of acetyl-CoA to trigger energy production. It reacts with dopamine to create a chemical called salsolinol, which is a phenolic compound. And then serotonin reacts to create beta carboline right here. And this is obvious that you can think about this for reward. So one of the things we give for this is, Clarify 4.0, because it helps to get their reward signaling up and they end up feeling okay. So what are the side effects of acetaldehyde? I mean, pretty drastic: addiction, chemical sensitivities, headaches, foggy head, impaired memory, mood disorders. And then this kind of shows it. Nearly all organ systems are involved in heavy metal toxicity. The most commonly involved organ systems include the central nervous system, peripheral nervous system, gastrointestinal tract, hematopoietic, renal, and cardiovascular. Well, what doesn't it affect, right? So what about stress in the gut? So one of the things that we talk about is that impact of metabolic stress on the intestine. So if I'm under stress, the hypothalamus can either go to the adrenal glands and tell it to make cortisol. When you do that, you increase permeability of the gut. That's what this is showing. If you go straight down from the right and then go over to the left. The other piece is that if the enteric nervous system is signaling, that can also cause the problem. And let's take a look at that. Whoop. Don't take a look at that. So the point being on this is that with this workup, you can start to see where people, if I deal with their food allergies all the time and I never go upstream to work on their brain, I'm probably not ever going to get them over food allergies. So at the same time, you can see the value of using, things to support the adrenals and all that kind of stuff down the HPA axis. But that's because you're trying to block what's going on with the excessive sympathetic nervous system stimulus and what's happening to the leakiness of the gut. So this is pretty cool. This is metabolic inflammation in the gut. So poor dietary intake, inflammatory food, stress and emotions, infections, lectins, systemic disease, low stomach acid, exposure. Where does it lead to? I love these tricky slides. So if you look, at least the food allergies, malnutrition, elevated toxin and antigen burden, dysbiosis, toxic overload, and then of course, systemic disease over on the right. And our genes end up dictating when, and probably ended up where we're going to end up with our diseases. And then there's LPS and endotoxemia, right? You hear me talk about LPS all the time. This is chronic non-communicable diseases are leading cause of work absence, disability, mortality rate worldwide. Most of these diseases are associated with low-grade inflammation. When your gut is off and you make endotoxins, you're going to have more barrier issues and more inflammatory issues. And understanding that lipopolysaccharide induces autoimmunity and enhances nephritis. And, it's a experimental model. It showed other things as well, but it's just understanding that you quickly get into a side effect profile when your body shifts in this direction of dysbiosis. And here's all the effects of lipopolysaccharide on metabolism. White blood cell counts go up, transient heart rate, autoimmunity. You can see all the lists here. So what do you do? I want to leave time to talk about what products to do for what. Meant to be a short education piece today. You should do food antigen testing on anybody that has autoimmunity. If anybody's aching, they should have it. If they've been on medications like PPIs, H2 blockers, oral contraceptives, antibiotics, metformin, antipsychotic drugs, all the big players on that drug scene are disrupting the gut and can lead to that leaky gut. But you can re-regulate that. The next phase is understanding an elimination diet. Well, if you're using the metabolic code plan, it is an elimination diet that teaches people how to reintegrate foods and see how they react. So we're handing you that elimination diet. And you can use it, right? It's great. And do people get better when foods are removed? Of course they do. But they really don't get lasting benefit if they don't take care of that re-regulation of immunity with probiotics, rebuilding the gut, cat's claw, berberine, etc., and grapefruit seed extract, olive leaf extract, oregano extract. There's so many things that can kill off bad bugs, and that's what you're really looking to do. So one of the big areas is exactly that. So how do I correct this? Well, one of the values of berberine is that berberine reduces zonulin and improves tight junctions. So that's a product that we have called rebiosis that kills off the bad bugs and helps to stimulate restoring intestinal health. You could go to PHP and use Micostat C if you wanted, or monolaurin. Just get started somewhere with giving something that is going to start to knock out the bad bugs and preserve the good. You can certainly use the ProFlora Max Plus from PHP, great flora product. And then what am I going to do to heal the gut? Well, that's where you can use things like glutamine powder, DGL licorice powder, and make sure that you're dampening that response. But the big thing you got to think about is, why is it there? Is it there because of antibiotic use? Is it there because of stress? Why am I landing here? And that's the key. And then that would vary on how you would treat that, right? If it's toxic metals, you do things like fulvic acid, so the Detox 3.0 or the Detox Accelerator are great oral detoxifiers to take, incredibly important. And then from there, you go, well, I'm going to need a probiotic. Do I need a digestive enzyme? Are they still belching and burping after 2 weeks? If they do, they need to get them on an enzyme. And then, you know, what else can you do? Things like carnosine, really good. But one of the, probably the most important things that you can do is get people to exercise moderately to get the fight or flight response out of them. It'll make a huge difference for them. But my point is to this call is really to understand that IgG4 and C3bd are actually show dramatically heightened response. If you've got that C3 complement on something, you need to get to work on your health. And I think that's important. So I'm gonna leave it to a few questions if anybody has any questions. But the purpose of this was just to kind of get out the fact of, hey, there's a whole bunch of different allergy tests out there, guys. This is the one I use in my practice for a reason. We get stellar results. They test IgG4, they test you know, the C3bd complement, and it's covered by insurance when you code it correctly. Even I think it's Medicare that they cover it as well. So I think it's invaluable. So let's get on with and see if there's any questions, and we can go from there. But we, you know, purposely kept this a little bit brief because this is an in-between week talk. We're going to throw these in there on you. So if you want to learn something, you can, and then we'll go from there. So questions? No questions. Okay, that's good. I think this is pretty straightforward. I don't know if anybody has used Infinite Allergy Labs to check both IgG4 and C3bd yet. It's relatively new. I am doing some education for them. That's why I wanted to bring it up. But that C3bd is probably the most potent thing to look at, say, your thyroid antibody cases or your colitis cases to really find out what foods they're having serious reactions to.
Okay, we have a question. How do you handle hypoperistaltic problem in children? Hypoperistaltic.
Oh, yeah, it's a good one. Well, the one thing I do is if I reach into my homeopathy bag and use something called Colosynthis. COLOCYNTHIS. You can get it at Whole Foods or Sprouts. It's a homeopathic medicine for, like, you know, children that are, you know, kind of constipated and hypoperistaltic. You could give them a little bit of magnesium. You want to check their tongue. Is their tongue coated? If it's coated, you got to look for yeast. Clean up their yeast. Give them a probiotic. If they need a little bit of magnesium, sometimes that clears it, but I don't like to give magnesium to where they have a loose stool. But that's pretty much what I do. I'll use Colosynthis, I'll get their magnesium up, and then I'm looking at what food allergies they have. If it's hypoperistaltic, really suspect either dairy or gluten. Those are the two biggies that really shut down the gut and create erratic gut behaviors. So that's how I would approach it. You can always, in a child, I'm not giving digestive enzymes or that kind of stuff, but you got to get him to eat well too. So that's how I would do it.
Great. Anyone else? You can just type your question in the chat box. Like, the answer was cholosynthis. Yes, synthis. THIS. From I think Jim, you said either Whole Foods or
Yeah, if they want to order it direct, if they wanted to order it direct, they can get it from Boiron or Boiron from France. Washington Homeopathics, if they're wanting to order it, or they could go to a Whole Foods or a Sprouts or any of the places that carry homeopathy. Typically, the dose you'll give a child will be like a 6C. The beauty about homeopathy, there's no side effects to it. So that's what's really cool about it. No side effects. They chew up the little pellets and go from there. But I'm telling you, you got to have them stick their tongue out. I have so many kids, they got a white, frothy little tongue, and that means that they got dysbiosis, and you need to work on cleaning it up.
anyone else? Don't be shy.
That's good.
Yeah.
No, I mean, I hope everybody's figured out how to work on food allergies and correct the gut lining of the intestine on individuals. Because I know I struggle with it all the time still. I'm always working at trying to, here's the thing. Why do you test for the food allergens? Because like, we don't do it on everyone, but on people that the more they're inflamed, the more we do it, because you can give everybody all the best pills and tell them to eat a great diet. But if they're eating foods that they're intolerant to and their gut is broken down and that gut is leaky, they're going to keep getting allergic, and they'll just get allergic to the new foods that you took them off of, or you let them allow on their last test, and then they become allergic to it because they ate them too frequently. So it's important to understand the concept of metaflammation. I'm going to correct the terrain because I'm going to change the eating pattern, give the nutrients that restore the gut, and I'm going to work towards what brain or nervous system issues might be going on that's triggering my immune system or environmental burden. And I think that you want to be thinking of this in an organized kind of network pattern, not just one-offs.
We have another question, Jim. Thanks. For Dawn Hughes. What supplements can we use to calm, heal the gut in patients with high blood pressure, those who cannot tolerate licorice?
Well, DGL licorice does not cause hypertension. So if you get DGL, deglycerinated licorice, it does not cause trigger hypertension. But what you could do if you're looking for healing, I know we're developing a powder, that avian egg albumin is really good at restoring the gut. We have a glutamine, zinc carnosine, and resistant fiber powder that's coming out. But if nothing else, think of zinc carnosine and glutamine. You could also use slippery elm and aloe. So aloe is really good for, helping to heal the gut lining as well. So you got a couple options there as to what you can do, but don't worry about DGL licorice. It won't change. It won't cause blood pressure spikes. Only typical licorice, where you have the glycyrrhizin in it, will it trigger that, ACTH and increase and potential increase in blood pressure. Although I've rarely seen that, maybe once in my 38 years.
Jim, I have a question for patients with brain inflammation. Would you still get L-glutamine? This is my question, versus something like a.
Well, that's following the Russell Blaylock theory that taking glutamine makes glutamate. and I've given out glutamine for a lot of years, and nobody's brain goes on fire and they don't get anxious. I've had one or two people, but that's it. You got to remember, if you're drinking glutamine, glutamine is conditionally essential for building the enterocyte of your gut. No glutamine, no building the gut lining, because you need basically two molecules of glutamine in order to build the scaffolding or the rebuild of that epithelial cell. So if you can't do it that way, then you got to think about, how am I going to increase my butyrate production, which is give resistant starch or eat resistant starch and allow your beneficial flora to add the short chain fatty acids, butyrate, get that enterocyte to build up. But typically you need some glutamine in order to make that building occur.
Great, thank you.
All right. No other questions? We're only getting done about 10 minutes early. That's perfect. I purposely wanted to do these. I hope you guys like these little vignettes. I mean, we'll, as we send this out to people, I'd love to get some feedback, because we can do little 30-minute vignettes, once or twice a month, and just post them for you. And you can hear them. We don't even have to do it live. We can just record them and pop them up there for you. So you can give us some feedback on that if you'd like. Whoop, what'd I do? There we go.
I think that's it. Anyone else?
Perfect.
I think we're good.
All right. If anybody had any questions on ingredients, now's the time. Nothing?
Yeah, I just wanted to say one more thing. If you haven't already signed up for a membership on our new website, metaboliccode.com, you can sign up as a practitioner to order our new line of supplements. So please go ahead and go to metaboliccode.com and then just access the practitioner link.
Yeah, that's great, Martin. If you haven't tried the avian egg albumin, I mean, it changes your gut brain serotonin so fast. We've got a lot of people saying how much better they feel on that. And of course, the rebiosis with the cat's claw, the berberine, and the grapefruit seed extract together, all in full clinical doses, which is rare to find. Man, you gotta try it. And of course, we've got fiber as well. So that great sunflower fiber, which, I mean, people are raving about it because there's no abdominal distension or discomfort, and they get, great immune benefit from it. So, check it out if you haven't already, about the formulations that we've developed for the program. All right. Well, I think we're good.
Yep, we're good.
All right. Thanks, guys.
Thank you, Jim. Bye-bye, everyone.